Bhavesh sir, shall we start? It's 10:05. Bhavesh sir? Sir, you are mute.
Please
Mute.
start. Please start. Yeah.
Yes. Romesh Prajakta, you can start.
Yes. Good morning, respected seniors, colleagues, and my dear students. I, Dr. Romesh Bagde, on behalf of Psychiatric Society of West Zone, welcomes you all on another session of Scholarly Sunday session. I welcome Dr. Bhave sir, President, Psychiatric Society West Zone. I request you, sir, to enlighten us with some word of wisdom.
Yeah. Thank you so much, Ramesh. As always, the PG subcommittee is doing a wonderful job. I think the hallmark this year is absolutely wonderful topics. And I think it is the topics largely, and of course, the people who talk about them that are gathering such a large number of attendance. I think when it comes to attendance, perhaps West Zone has not seen this kind of attendance in any subcommittee meeting this year or even in the earlier years. I think a large share of the credit goes to the brain behind this entire program, Dr. Sushil Gawande, a man for whom I have always depended on for very creative ideas, which are also implemented very creatively and smartly. So thanks, Sushil, for this wonderful topic this time also. And thanks to Prajakta and Romesh, who have agreed to conduct the session. And I'm very sure this time the attendance, as Sushil has noted in one of his earlier posts, ab ki baar 200 par seems quite likely. So I'm sure that all those who attend are going to benefit. And those who attend, please spread the word that this committee is doing fantastic work, and their colleagues who have been missing out on the programs must not miss them. So thanks for inviting me. Over to you, Ramesh.
Now I would like to invite Dr. Sushil Gawande, Chairperson of PG Education Subcommittee, IPS West Zone branch. Sir, say a few words regarding the topics and enlighten us.
Thank you so much, Romesh. Hope I am audible.
Yes, sir.
Yes. So mnemonics are very close to my heart. Means from the time I have started my remember from the 10th standard onwards, I am using it very frequently, and I find it very useful. So I thought it would be very useful for the students, because in a psychiatry we have so many criterias to remember. Then if we have something handy instrument to remember them, it would be very useful. So I won't take much of a time. I thank Dr. Bhave for attending this session, and I welcome all the office bearers of Psychiatric Society West Zone and all my committee members of PG Education Subcommittee. And best wishes to Romesh and Prajakta for this wonderful session. And congratulations to all the participants for joining. I'm very sure that you will be enlightened and you'll be greatly helped with this session, and it would make your study very easy in psychiatry. So thank you again, and over to you, Romesh.
Thank you so much, sir. Now, without wasting any further time, I would like to introduce Dr. Prajakta Patkar, who is working as an assistant professor in the Department of Psychiatry in Topiwala National Medical College. So, ma'am, the mic is over to you. So, please introduce the session and carry forward, ma'am.
Thank you so much, Ramesh. Thank you, Bhave sir. Thank you, Gawande sir. I think this is a very interesting topic, especially for PGs. And I mean, just yesterday, MUHS exam dates have been out. So I think that's the best time for us to start with this session. Ramesh, can you just do the share screen?
Yes, ma'am.
Right. So before we start, I would also like to wish everyone a very happy Easter. I don't know if anyone is celebrating, but happy Easter from all of us at the IPS PG's West Zone PG subcommittee. So exams creates a lot of stress. Romesh, the screen is not visible.
Wait, ma'am.
Yeah. So exams get us a lot of stress, and there's so many things to remember, of course. I'm sure you guys have faced the same when you're preparing for your NEET PG exams. And remember, there are few things which you just have to probably remember the way it has to be remembered. You can't miss out on certain things which are very, very important. Maybe sometimes there are certain criteria, or there are certain symptoms that you cannot miss. There are sometimes it's in an order and you need to remember that order. So all of these things become difficult. I mean, I'm sure you guys all read theory, and understanding is a different concept, but memorizing something, that is something which is more difficult. Um, yeah, so that's why I think sir has come up with this very interesting topic for you guys. Just waiting for the yes. Okay. Can we go back, Romesh?
Wait, ma'am. Actually,
Okay, wait one second. Let me share the screen.
okay, ma'am. Wait, ma'am. I think this one is the.
Is there? Yes, is there?
Perfect. Okay. Anyone till we figure this out? Anyone wants to maybe say something where what do they find difficult in memorizing something? Any of the
Ma'am,
PGs
now
want?
it is visible.
Yes. Can you put it in slideshow mode?
Yes, ma'am. It is in slideshow mode.
No, Romesh, it's not.
It's in a page mode.
Yeah, we can see the page mode, Romesh.
Just forward it to me on my email, Romesh.
Anyways, look, let me start till we figure this out. So what's a mnemonic? Mnemonic is something which it's a sort of a learning technique. Now, what it does, it makes info whatever information you have, it makes it easier to retain the information and to retrieve it from our memory. And it does this by associating the information with something which is easy to remember. So it makes something which is very complicated or very something which has a lot of details, and it becomes difficult for us to remember. So a mnemonic is something which makes it easy so that you remember, retain, and retrieve it easily, right? I mean, if you go back, it was started by Greek philosophers and Greek teachers. That's how history goes back to mnemonics, and there's something which people found that it aids memory. So it enables the mind to reproduce something which is unfamiliar to you, something which you can connect to something which you can remember very easily, right? So that's what a mnemonic is. I think I'll share it, sir. I
Yes,
have it.
Parajita, you can share it from your
I'll
end.
share it. Yes.
Romesh, you can stop sharing. Yes.
Yes.
Okay.
Very sorry, guys, for this. Okay. Share screen. Yes. Can everyone see my slide? Is my slide visible?
Yes.
Yeah,
Yes.
it is visible.
All right. So we already went through this. Okay. So what are types of mnemonic? Just to just to give you examples, you can make a song out of it. Kids have it in like some songs or jingles, or you can make a name mnemonic, wherein you can take the first letter of each word and make it into a new word, or you can take the first letter of multiple words and then make it, you make it into some word which is meaningful, or some word which probably is not very meaningful, but you can still remember that word rather than, the whole series, right? Then there is something called as acrostic mnemonic, which is the first letter of each word is combined to form a phrase or a sentence. So, like they've given this example, but we'll go through these things when we go ahead. And you can also make an image mnemonic. So this is something where you need to get more creative with your ideas, where you make an image which is easy to remember and something that you can practice or revise very fast and make a mnemonic out of it, right? So we have got some very, very interesting uh, mnemonics from students, from teachers, from across Maharashtra, Goa, and some of them Romesh has made them by himself. So we thank Romesh also for that. So let's start with the first mnemonic. This was sent to us by Dr. Yash Waghani from NKP Survey Medical College, Nagpur. Depression, right? So depression has so he's made it into exactly the word depression, where D is depressed mood, E is energy loss, P is pleasure loss or anhedonia, R is nothing. And this is something that you can do. If there is some word where you don't think it's there is something related to that word, it's okay. You can skip that word, but still you can utilize the whole word, right? So R is nothing. E is excessive psychomotor retardation. S is sleep disturbance. S is suicide. I is indecisiveness. O is overt guilt. N is net weight loss. Now, you need to remember that these mnemonics that you make up, these ones are not exactly DSM criteria or ICD criteria, but you can make up your own ones with DSM or ICD criteria, or you can use these kind of mnemonics to just remember the core symptoms, and then you can work your way around it, how to remember the criteria or some other symptoms, signs or symptoms associated with it, right? Next is borderline personality. Now, this all the personality disorders, very, very difficult to remember these mnemonics. We also so okay, borderline personality. We do associate it with impulsiveness. Yeah. So I is impulsive, M is moodiness, P is paranoia, U is unstable self-image, L is labile relationships, S is suicidal gestures, I is inappropriate anger, V is vulnerability to abandonment, right? E is emptiness. So this I think perfectly kind of summarizes what a borderline personality disorder looks like. Similarly, you can make for all the other personality disorders also, and then that makes it very easy to memorize it. Yeah. Narcissistic personality. What does a narcissist want? Wants fame, wants recognition. So fame game. So that's how you need to make these mnemonics, where you make that name which is easy to remember with a particular idea of that topic. So narcissistic disorder, narcissistic people want fame. So then you can make something which is associating, so that it's easy also for you to remember. Otherwise, if you will make some other word and then you cannot associate the two, if it's something like as random as a plant, then how are you going to remember that okay, the plant wala mnemonic is for narcissistic personality? So there is something that you also need to make, rack your brains a little bit so that you make that connection and your mind remembers that connection. Yep. So F is for fantasies about success. A is for arrogance. M is for manipulativeness. E is for envious. G is for grandiose. A is associates with celebrity. M is me first attitude. Wow. And E is empathetic, empathy lacking. This is a very nice one. Yeah. Serotonin syndrome. Does anyone know? Just to get you all involved, does anyone know what is serotonin syndrome? Any PG wants to go? You can unmute yourself and tell us what is serotonin syndrome. Are you guys typing in chat?
Yes, they are
Yes.
typing.
Yes. Okay. Okay. What else? So Wonder Woman says flu-like symptoms. Vidhu is saying MAO inhibitor with SSRI. Okay. Anyone else knows what's a serotonin syndrome?
Someone has tried MAO inhibitors with SSRIs.
Yes, exactly. Yes, thank you, sir. Yep. So serotonin syndrome, it's very important. You almost always get short notes on it. So if you don't know about it, go and read about it. But you can easily remember it with the word HAN. Harm is hyperthermia. A is autonomic instability or delirium. R is rigidity, and M is myoclonus. Yep. All right. So the next one. Okay. Yeah. Tricyclic antidepressant. Now, this is something which a lot of people find it difficult to remember. Side effects of each drug. So this one also we got as an entry, and this is so easy to remember. T is thrombocytopenia. C is cardiac side effects, which is arrhythmia, MI, and stroke. A is anticholinergic, tachycardia, and urinary retention, and S for seizures. So simple and easy. TCA is ka TCA, right? So side effects you don't have to remember any other word also. The same word that they have used. I'm sorry. Yeah. Neuroleptic malignant syndrome. Anyone wants to tell me what's neuroleptic malignant syndrome? Come on, ये तो पढ़ा होगा neuroleptic malignant syndrome. Anyone? PGs. Okay. Due to typical antipsychotic effect, a type of EPS. Yes. What else? But what happens? What exactly is it? It's a side effect of antipsychotics, definitely. Yes, there is fever, diaphoresis. Yep. So it's a life-threatening reaction to antipsychotics. And has anyone seen a case of an neuroleptic malignant syndrome? Dopamine blockade, right? So very easy to remember the treatment. How do you treat neuroleptic malignant syndrome? A is amantadine, B is bromocriptine, C is carbidopa, levodopa, and D is dantrolene. Yeah, but this is the medical management. Obviously, you do need to remember everything else that you need to do with regards to NPS.
But it's excellent, huh? Whatever
Yes,
this
yes.
new is ABCD is excellent, excellent.
Okay, so this was sent to us by Avinash Joshi sir. Histrionic personality. We finished by borderline. We finished narcissistic. So histrionic personality. Yep. So what do? They demand. They demand a lot of things. And sir has perfectly put it. D is demanding. E is emotional lability. M is manipulativeness. A is attention seeking. N is narcissistic. D is demonstrative. And S is seductive. Amazing.
Perfect. It's
Yes.
perfect.
So, okay. Next one is sent to us by Shilpa Adarkar ma'am. So she said, she sent us all the mnemonics related to de-addiction. So brief intervention. Can anyone tell us what is brief intervention with regards to the uh, substance abuse?
Alcohol de-addiction.
Yes. But what about it? Dr. Kanchan, can you tell us a little more about it? Yes. So it is for improving motivation. It's like MET, it's a part of MET.
Motivational interviewing.
Right, exactly. So very easy mnemonic frames where you get feedback from the patient. There is responsibility, there is an advice menu of options. You need to be empathetic and you need to make them self-efficacious. Yep. So this is the mnemonic for brief intervention. Similarly, ma'am has sent another one for motivation enhancement therapy, which is DARES. DARES is D is developing discrepancy, A is avoiding arguments with the patient, R is rolling with the resistance. They are going to resist you. So you have to roll with the resistance. E is expressing empathy with them. And S is supporting their self-efficacy. Yep. So, and don't worry, we are all going to we'll share this on the group. So you don't need to keep writing all of this. Another one for motivational interviewing, ORS. O is open-ended question. A is affirmations. R is reflections. And S is summarize. This was sent to us by Dr. Akshay. I can, yeah. He's from NKP Survey Medical College, Nagpur. So frontal assessment battery. Can anyone tell us what's frontal assessment battery? Where do we use it? Why do we use it? Do you guys use it in your ward? Frontal lobe testing, perfect. Do you use it in your ward?
No.
No? Okay. Can anyone tell us? Yes, bedside screening tool used for frontal lobe function, definitely. Perfect. It's a very, very simple test. Most examiners will ask you, how will you do a bedside screening for frontal lobe examination? Yeah, so this is how the FAB goes. So he has made it Silafia goes primary. Okay.
Prajakta, it's Silphia. Silphia goes primary.
Yeah. Okay. All right. Sorry, sir. Silphia goes primary. Okay. So SI is similarities. LE is lexical fluency. FI is fist palm edge. Fist palm edge पता है ना? Test होता है. Fist palm edge. A is alternate tapping. Goes is go no go वाला जो test हम करते हैं. And P is primary reflex. Yep. So similarly, you can make it for other lobe functions also. Where do you guys read lobe functions from? Lobe functions test पढ़े हैं सबने? You need to know all the lobe function tests. Please read if you have not read. Okay. This is Scrub and Black, definitely. Wonder Woman is, she is quite active. Scrub and Black. There is another book I forgot. I'll remember the name and I'll tell you.
Lishman.
Lishman also, yes. There is one more.
Fuller. Yes.
All right. So Dr. Vidhu Arora from YCM Pune. She has sent us this mnemonic for delirium. Yep, delirium is something that we very often encounter. There are many of the medical ward के calls are on for delirium. ये patient delirious हो रहा है, patient को कुछ अजीब कर रहा है, admitted for something else but delirious. Yep. So D is disturbance in attention. E is emotional instability. L is language disturbance. Now, I don't know what exactly she means by he or she. I don't know Vidhu. But Vidhu, I don't know what you meant by language disturbance. But maybe she meant that the patient is not very, um, what do you say?
Coherent,
Not
not coherent.
Might be
correct.
coherent or might
Yes.
be
Coherent. Yes, exactly.
irrelevant.
Irrelevant. I is
Yes.
illusions and hallucinations. R is reversal of sleep-wake cycle. Perfect. I is inattention. U is urgent onset. Wow, perfect. And M is memory impairment. Yep. So Dr. Vidhu has sent us this for delirium. Next, clozapine. Clozapine is something, this is a question which is always asked in practical exams, maybe sometimes in the paper also. So side effects of clozapine, very favorite question of all the examiners. God damn safe. Yeah. G is, yeah, it's a long answer question also. Yes, Kanchan. So G is granulocytopenia, O is orthostatic hypotension, D is drooling, D is diabetes mellitus, A is anticholinergic, M myocarditis, nocturnal enuresis, S for seizures, A for agranulocytosis. Again, agranulocytosis has come again, but it's okay. F for fever and E for ECG changes. Yeah. Can so this is again, this is a long answer, can be a short answer. Sir, you were saying something, Sushil sir.
No, no, please carry on.
So clozapine needs to be clozapine, very important. All the examiners want to ask you side effects of clozapine. Yep. Schizophrenia, negative symptoms of schizophrenia. Stone face, perfectly made. S for social withdrawal. T is for thought poverty. Overall apathy, no motivation or evolution. Emotional blunting, that is stone. And flat faces, flat effect, anhedonia, communication issues, or alogia, and poor eye contact. Yeah. And this is sent to us by Dr. Kanchan only, who's been answering in our chat box. So she has sent, she's from Jalgaon, so she sent us a mnemonic on tuberous sclerosis, which is epiloia. Epi is epilepsy, low, LOI is low IQ, and A is adenoma sebaceum. Perfect. Yes, again, neuroleptic malignant syndrome has come back. Fever. F for fever, E for encephalopathy, V for vital sign instability, E for elevated WBC and CPK enzymes, and R is for rigidity. And serotonin syndrome has also come back, which is harmed. So H is for, so that one was treatment. We were treating the serotonin syndrome. This is for remembering the symptoms of serotonin syndrome.
Symptoms.
So harm. H is for hyperthermic or hyperthermia. A is autonomic instability. R is rigidity. M is myoclonus. E is encephalopathy and diaphoresis. I think now I will give over to Romesh for the next couple of next few mnemonics. Over to you, Romesh.
Yes. Thank you, ma'am. Ma'am, can you? Yes. Next one is for antidepressant discontinuation syndrome, and the mnemonics is Finnish. F is for flu-like symptoms, I for insomnia, N for nausea, I for imbalance, and S for sensory disturbance, and H for hyperarousal. So this one is for neuroleptic induced Parkinsonism. The mnemonic is TRAP. T stands for tremors at rest, R for rigidity, A for akathisia or bradykinesia, P for postural instability. Next slide. Then this one is sent by Dr. Yashika from Vadodara for executive function, and the mnemonic is POSHA. P is for planning, O for organizing, S for sequencing, and A for abstract thinking. Next. This one is taken from a book, and this one is the symptoms of catatonia can be explained by G-Man Sweeps Minecraft. G stand for grimacing, M for mannerism, A for agitation, N for negativism, S for stupor, W for waxy flexibility, E for echolalia, E for echopraxia, and posturing, P for posturing, then stereotypy, mutism, and catalepsy.
Yes.
Next slide. Then for generalized anxiety disorder, watcher is the mnemonic. W for worries, A for anxiety, T for time at least for 6 months, C for controlling the worries is bit difficult, H for handicapping, E for excluding other psychiatric disorders, and R to rule out other psychological effect due to substance or other medical causes. Then this one is taken from a very good book uh, by Kaplan, agoraphobia. Though agoraphobia in this whole DSM criteria has been explained with the help of poop and phobia. Those COOP. Uh, C for crowded place, O for open space, O for outside the public transport, E for enclosed space, and the B criteria is fulfilled by the mnemonic phobia. P is persistent for 6 months. H for handicapping, O for out of proportion anxiety and fear. V because of this because B for because these symptoms uh, because of these symptoms there are escapism behavior, and also uh, these symptoms are due to the patient is having escapism, and I for intense fear or anxiety, or A for avoidance behavior.
Similarly, you can, so this is made for a particular DSM criteria. You can
Yes,
make
yes.
it for others also. Where there is, because sometimes it becomes very difficult. A wale mein kya hai, B wale mein kya hai. So this you can make it for others also. Very nice.
So this one is for body dysmorphic disorder, and the mnemonic is pain. So preoccupation with perceived defect is there, then act in response to the appearance concern is there, and then impairment in socio-occupational functioning will be there, and this should not be due to eating disorder. So this the symptoms of body dysmorphic disorder can be remembered by the mnemonic pain. Next one. Then this one is for hoarding disorder, and the mnemonic is piled. So P is perceived need to save items or distress associated with discarding, resulting in inability to discard the things, and then there as a result of which litter of possessions will be there, and then excluding E for excluding another medical or mental disorders, and there will be distress or dysfunction in socio-occupational functioning. So from piled we can remember hoarding disorder.
हर एक
Next one.
पेशेंट सब कुछ पाइल अप करके रखते हैं घर पे.
Piled up करके.
Yes, yes, yes. So for autism, we can remember by autistics. So A stands for again and again, then U for unusual repetitiveness to sensory stimulus, then T stands for toddlers, then insistence of sameness will be there, then socio-emotional reciprocity defect will be there, then to relate with others will be difficult for them. Then I stands for impairment in socio-occupational or other functioning, and there C for communication. There will be poor communication, and there will be social difficulty in social communication also. So autism,
Romesh,
yes.
during our post-graduation, na, we used to follow one mnemonic for autism. So in autism, last word are I, S, and M, right?
Yes,
So
sir.
I for interaction, that is social interaction.
Yes.
S is for spoken communication, and
Yes.
M is movements, that is stereotype movement. So
Stereotypical.
ISM, three main criterias: interaction, spoken communication, and stereotype movements. M movement stereotype.
Yes.
Thanks, sir.
So trichotillomania can be remembered by the name hair. So here H for hair loss and A for attempts. There will be repeated attempt to decrease the decrease or stop the hair pulling, and there will be impairment in socio-occupational functioning. And R stands for to rule out another psychiatric or medical conditions of hair loss. So next one is skin excoriation, and the mnemonic is skin. As for skin picking resulting in skin lesion, then there is skin to decrease or stop the picking by repeated attempts will be there, and then impairment in socio-occupational functioning will be there, and this disorder should not be attributable to any other substance induced or medical or another psychiatric disorder. So this one is for skin excoriation. So for dissociative identity disorder, the mnemonic is DID. So D stands for disruption of identity with two or more distinct personality. Then I will be inability to recall properly the traumatic event, and D will be for distress or impairment in socio-economical socio-occupational functioning. So, ma'am, can you continue from this?
Okay. All right. So what is depersonalization? Yep. It looks like a dream. Derealization looks like a dream. So D is detachment experiences. R is reality intact. Reality testing is intact. E is excluding other primary mental disorders. A is attributable not to a substance or any other medical condition. And M is marked distress caused by symptoms. Perfect. Depersonalization is dream. Starlight principles applied to literature search. Wow. Okay. So this is how do you search literature? S is sampling strategy. T is type of study. Then you go for approaches. R is range of the years. L is limits. I is inclusions and exclusions. T is terms, and E is electronic sources. Wow, this one was very interesting. I don't, do you guys read up articles, or do you have journal clubs in your colleges? Just wondering, how do you read up articles, or it's only textbooks? Okay. ADHD runs fast, amazing. Runs, climbs, restless, uninhibited, not able to play quietly, fidgets, squirms, interrupts. D for difficulty waiting for his turn. G is get going or acting as if driven by a motor. E is evacuates seat unexpectedly, and T is talks excessively. Right. A lot of them, DSM criteria they have involved. Um, this is disruptive, impulsive, and conduct disorders, and ODD, real bads. Okay. So obviously these ODD kids are something that we always keep calling them, you're a bad boy, you're a bad girl. So real bads. Resentful, easily annoyed, argues with adults, loses temper, blames others for his or her misbehavior, annoys people deliberately, defies rules, and is spiteful. Perfect. So 4 out of the 8 symptoms within the last 6 months. This was a nice. Conduct disorder is bad
For a
bad
business.
for abuse. Sorry,
Bad for a business.
bad for okay. B is bullying, animal cruelty, destroying others' property, fighting, out late at night, running away from home, actively forcing sex, okay, being cruel to people, using a weapon, setting fires into someone's house, building or car, not going to school. Nice. This is also nice, but also remember that sometimes if you use ekdam aisa going into someone's house, building or car, that's a literal thing that you'll have to that they do. But when you are, I mean, you'll probably have to also have some terms where it's very inclusive of a lot of things. Narcolepsy. Chess. What is narcolepsy? Can anyone tell us what's narcolepsy? Excessive sleep. Barabar. What else? Okay, all right. You guys will go and read is something we understand. So narcolepsy, C is for catalepsy, H is hypocretin deficiency, E is evidence in sleep studies, and S is sleep attacks. Yes. Yeah. So this is for sleep apnea, obstructive sleep apnea, stop, bang, snoring, tiredness, observed apnea, high blood pressure. So P comes from for the pressure, BMI, age, neck circumference, and gender. Yeah. And this is Charles Pinto. Does anyone know who's Charles Pinto?
This one is a tribute to Charles
Yes.
Pinto sir from my
Nice.
side and from
This is perfect. Yeah. So, Sir was a professor in Nair Hospital, and we all look up to him. So Romesh has made this for irreversible causes of dementia.
reversible and irreversible causes of
Irreversible.
dementia. Yes.
Reversible and irreversible. Sorry. Congenital or genetic, which is Huntington's, Wilson's. Yep. H is hypoxia or hypoglycemia. A is autoimmune and allergic reactions. R is recreational drugs. It's caused by that. L is lesions, any strokes, tumors, trauma, endocrinal problems, thyroid disorders, Cushing syndromes. S is seizures or epilepsy, like temporal lobe epilepsy. Psychiatric disorders can also cause dementia, like schizophrenia, bipolar disorder, infections like meningitis, syphilis, neurosyphilis, HIV, nutritional deficiencies like B12 and thiamine. T is toxins or medications, toxins like steroids, anticholinergics, heavy metals, and other metabolic symptoms, other metabolic causes like electrolyte imbalance.
I think that's wonderful, Romesh, because Dr. Charles Pinto was an expert on dementia. He had much
Yes,
work
sir.
in dementia when he
Yes.
had started that idea of brain bank. So, I mean, that's a very apt mnemonic. Wonderful.
Thank you, sir. Thank you.
Yeah.
Thank you, Romesh, for this. Again, does
And this
anyone
one
know?
is a tribute to Bhaiya, sir.
Obviously, everyone knows Dr. Bhaiya. So, organic causes of
Organic causes of dementia or
dementia.
any neurological disorders.
Yes, okay. So Vaya is V is vascular. So strokes, vascular dementia, TIAs. A is for Alzheimer's disease. H is Huntington's. I is infectious causes. HIV associated neurocognitive disorders, neurosyphilis, meningitis, encephalitis, and autoimmune or inflammatory disorders. This is something that we picked up from an article. We have shared the link of the article in the last slide. So this is an article where they have made a lot of mnemonics. So this one is for neurotic, mood disorders,
For
depression,
affective disorders. Yes.
affective disorders,
Yes.
depression, dysthymia, mania. So depression, they have said sig E caps, dysthymia, he's too sad because dysthymic people are always sad, hopeless, low energy, low self-esteem. Similarly, mania is dig fast. Depression is see, gasp, die. Tad high is for hypomania, and deter the high is for mania. So don't worry, we'll send it on the group also, so that you don't have to take pictures or write about it. But this is how you need to make these mnemonics, something which is easy to remember. Like this one is for medication adverse use. Finish, we saw fever, we saw harmed also, we saw. Uh, this is for GAD and PTSD, anxiety. Dreams was also something that we saw in another one also. So don't get confused. Sometimes you make the same word for multiple things. And because dreams is something that we made for dissociative, depersonalization
Depersonalization
and
and
derealization. So don't get confused. Sometimes that can also happen. Yeah, this one is perfect. This is for all the personality disorders. So we made that other one, which we had from the PGs, and this one is for all the 6 personality disorders. We'll send it to you. Don't worry. Yes. These are few links that we have. There are few articles where there are a lot of mnemonics. When we tried looking up, we found that these articles were something that they had a lot of mnemonics. And with this, I think we will end here. Sir, over to you.
Romesh?
Yes, so I would like to invite Dr. Bhave sir to give his conclusion comments and also declare the winners of all the entries which we have got.
Yeah. Thank you, Romesh. I think that is a wonderful session. Very, very, very useful. And the thought that you're going to put this on the scholarly sessions group, I think that's very heartening because, I mean, that will make it easy. Otherwise, as Kanchan has mentioned in her comment, we would need mnemonics for mnemonics. There are many of them. It's a khajana of mnemonics. Wonderful. Um, right. So, Sushil, I think, am I supposed to declare those things?
You can declare among practitioners, sir. Then I will declare among students.
Right. So I think as Dr. Gamade had announced earlier on the group, some of the best mnemonics are going to be declared. I'm not sure if they're going to get some prize or not. That's Sushil will tell.
That
But
would be at West Zone conference, sir. They would get prize at West Zone conference.
okay, yeah,
Yes.
that's great. So from the faculty, from amongst the faculty, those who gave the best mnemonics, first is Dr. Avinash Joshi from Nagpur, and now I may say Pune. He is basically from Nagpur, now settled in Pune. Second is Dr. Kanchan Narkade, whom you can see here, smiling all the way for, for having found a place in the first 3. And third is Dr. Yashika Nathani from Baroda. I think a very, I'm glad that all these 3 names are associated in the past or present with Nagpur. I mean, Kanchan and Yashika were both students in my department. Dr. Avinash Joshi sir is a very valued, very veteran member of IPS. Right. Over to you, Ramesh.
So I would like to invite Dr. Gavande sir to announce the names of students which
Yes.
yes, yes.
Yes. So thank you, Romesh, and dear students and those faculties. We will be giving these prizes in West Zone Conference, which is there in Nagpur in the month of October 2025. There were so many mnemonics, good mnemonics, and they would really help us to remember the things uh, perfectly. So in a students category, third prize goes to Dr. Akshay Vasnik for his mnemonic Sylvia Goes Primary for frontal assessment battery. And second prize goes to Dr. Yash Waghani for his mnemonic about depression. So all 9 symptoms are depression are accommodated in the word depression. And the first prize goes to a person who prepared mnemonic to remember the symptoms of delirium, and that is Vidhu Arora. So Vidhu gets the first prize for the mnemonic. Congratulations to all the winners, faculties as well as students.
I think we can see Yashika here, one of the winners. Congrats, Yashika. Yeah,
Thank you, sir.
yeah,
Hope you are doing well. Yeah.
yeah, all good.
Over to you, Romesh and Prajakta.
So I would like to thank Dr. Bhave sir, Dr. Gawande sir to provide this platform for this wonderful session of Scholarly Sunday. So with this, I call,
A special thanks to Prajakta.
yes, and I would like to thank Prajakta ma'am
Uh,
uh,
for
uh,
making the thing so interesting, okay?
yes,
And
for making the session so interactive and so informative. So thank you, Prajakta ma'am.
Also,
Thank you.
Romesh has made a lot of interesting mnemonics for us to remember, and he compiled the whole PPT also. Maybe he'll send it on the group and you all can have access to it.
Yes,
yes,
yes.
yes, yes, yes.
In
And through
future,
this,
sir,
uh,
I have also some more mnemonics in the name of Gawande sir, in the name of Silpa Adarkar
Bhavesh.
ma'am, Bhave sir. Yes.
Ramesh, you'd not believe. I immediately posted that mnemonic to Vaya sir.
Yes, sir.
And he's so happy to read that organic causes of dementia. And as you know, the sense of humor of Vaya sir,
Yes, sir.
he is saying that he's in the age group of dementia. So it's so appropriate. So, and again, let me use this platform to inform all the students. Please spread the news to your colleagues, as Bhave sir said in his initial remarks, that we are conducting so good sessions. So, we want to extend this benefit to all the residents of West